So what's the best way to ultimately get rid of shoulder impingement? Welcome to 2 Minute Tuesday, the weekly video designed to help you better understand pain or injury, keep you healthy, and improve your performance. So let's talk about shoulder impingement. So shoulder impingement is this sort of umbrella term or umbrella diagnosis that helps us classify pain in the front of the shoulder. This might include things like shoulder bursitis, rotator cuff tendonitis, or biceps tendonitis. But most people just call it shoulder impingement, pain in the front of the shoulder. And we used to think that shoulder impingement was a result of things getting pinched in the front of the shoulder whenever you raised your arm up or pressed or raised your arms to the side. We used to think there was a biomechanical fault where things would get pinched in this tiny little space here. What we used to do for it was a whole lot of pulling exercises, minimize the presses, and do a lot of rotator cuff work. And then in hopes that it would strengthen things up, help the mechanics, and ultimately go away. But now we know that shoulder impingement is almost a misnomer, as we're really starting to understand that this is more of a overuse in the front of the arm, and it's likely a rotator cuff tendonitis or biceps tendonitis that is causing your pain in the front of the shoulder. So what we do for it now to ultimately get rid of it is actually do a little bit more pressing, but just modify different variables to ultimately build up resilience in the tendons. You no longer have to do a ton of different rotator cuff activation exercises. You do not have to do any pulling exercises 2 or 3 times as much as you push. That stuff might help, but ultimately to build resilience back into the things that you want to do, which in your case might be pressing overhead, military presses, or even Olympic lifting overhead, we need to look at your training variables that may have caused the overuse in the first place, and then gradually build back up. So when it comes to shoulder impingement, we're thinking more of an overuse, maybe too much weight more than you're used to doing, maybe more volume that you're used to doing, causing pain in the front of your shoulder. And what we do is modify these variables, let the symptoms calm down, and gradually build back up into the pressing motions like bench, military, and things like the clean and jerk.